Thank you for the opportunity to present at Pediatric Trauma Society's annual meeting 2020. We have no disclosures to report. Isolated straddle injuries are relatively uncommon in the pediatric population, but can have lifelong consequences. Previous reports have focused on injury profiles, mechanism analysis, and indications for operative intervention. Most data supports the use of exam under anesthesia as the gold standard of evaluation in straddle injuries, but no study has described the role of radiologic imaging. Therefore, we sought to characterize the utility of imaging in blunt straddle injuries. We performed a retrospective chart review of our Level 1 Pediatric Trauma Center's patient database. ICD-9 and 10 codes specific for perineal trauma were used to identify the patient cohort. Information regarding patient demographics, injury characteristics, imaging completed, and time to the operating room was collected for analysis by manual chart review. Over 12 years, 83 patients met inclusion criteria. Mean age was 6.7 years with a range of 1 to 15 years old. The displayed graph shows the mechanisms of injury for all patients included in this cohort. Most patients were seen in the emergency department or directly by the pediatric surgery team, and of the 49 patients admitted, 48 of them required operative intervention, most commonly an exam under anesthesia with laceration repair. Mean length of stay for admitted patients was just over a day. Of the 83 patients in the cohort, 11 patients had imaging performed, most commonly X-rays or CT scans of the abdomen and pelvis. Importantly, no additional injuries were identified on any of these studies. Time to the OR was recorded for all 48 patients who required operative intervention. The mean time to OR was just over 6 hours. So to adjust for patients who were admitted for observation with plan for OR the following morning, we decided to look at differences in patients who are taken to the OR in less than 6 hours, eliminating patients with other contributing factors. Independent sample t-tests showed significantly longer time to OR for patients who were imaged. Multivariate linear regression was then performed, including age, transfer status, anatomic location of injury, and imaging. With age held constant, patients who had imaging performed were delayed in getting to the OR by an average of 96 minutes. Our study confirms previous reports that straddle injuries are usually the result of low-velocity trauma, such as falls, slips of pools, and bicycle accidents. In the pediatric population, EUA is often required for complete examination and laceration repair. Some studies report using procedural sedation in the ED as an alternative, which was not historically available at our institution. We found imaging to be of little value in these patients. In conclusion, radiologic imaging causes delays in the provision of definitive care for female pediatric patients with blunt straddle injuries. Furthermore, in our study cohort, imaging did not reveal any occult injuries, thus can likely be safely eliminated from the workup. This study is limited by its retrospective nature, small study group, and single center experience. Thank you very much.